This is the home modification program. And yeah, we'll get started. So if you haven't met me yet, my name is Katie Henderson, and I am an OT student at KU Med. I'm in my final semester, so I'm completing a capstone project at Gilda's Club this semester, and I'm focused on OT's role in cancer care. So I'll talk a little bit more about things I'm doing. So I'm delivering some programs throughout this semester, like this one tonight. And then I'm also holding OT consultation hours, and they are Tuesdays, 1 to 3 p.m. and Fridays, 10 to noon on Zoom. And I'm just able to help anyone who's interested with managing side effects that can come from cancer or cancer treatment, with just the hope that you can be more, easily able to do what you want and need to do each day. And I can also help with goal setting. So if you have any goals of things you're wanting to get back to doing in your life that you maybe were able to do in the past, but with the side effects from cancer and cancer treatment, it's making it a little bit more difficult. I can help with goal setting and problem solving different solutions, and developing an action plan to get back to doing whatever that may be for you. So if you are interested in meeting with me, you can email me at intern@gildasclubkc.org to schedule a session with me. I look forward to hearing from you. So today for home modification, this is kind of the outline of what we're going to be going through. I'll start with talking about what OT's role is in home modifications, and then we'll go through just a room tour of different rooms of house, like the kitchen, bedroom, bathroom, living room, hallway, staircase, entrances, and then finally the basement and laundry room, talking about different modifications in each of these rooms that you can make. And then also we'll touch on fall prevention, since a lot of these changes that you can make within your home are to prevent falls and just keep you safe in other ways as well. So we'll touch on fall prevention, and then end with some resources for home modification if you're wanting to do some of this or just curious how to get started, and then also an action log at the end. So we'll start with OT's role. So OT can really help with modifying your home by giving you kind of strategies for doing so, just with the hope of maximizing your ability to safely and independently do what you need to do in your home each and every day. So OT can help with optimizing the home environment just to increase your safety, security, usage of doing things throughout your home, and also just independence. So at the bottom here, you can see that in a study by Dixon and Toto, aging adults who made simple changes to their home were able to stay in their homes longer and reduce hospitalizations associated with falls and different injuries. So there is a lot of research to support the benefits of modifying your home in order to just keep you safe, and things like that. So more research on home modifications I wanted to touch on. In one study where they did home visits with OT and PT on home modifications, also education on cognitive behavioral strategies, and then balance related exercise with older adults. These individuals after this intervention had significantly less difficulty bathing and toileting. And in another research study, OT provided environmental assessment and home modification for older adults had a history of falls, and after having that home modification and assessment of their home, had fewer falls within 12 months compared to those that didn't have an OT assess their environment. So that's just some of the research supporting home modifications. I didn't want to mention before we get started some things to consider financially. So a lot of the things that I'm mentioning in this presentation, the modifications, there is cost associated with many of the modifications. So at the end, like I mentioned, I'll discuss a variety of resources available to make these changes in some lower cost ways to look into making changes like this. And also, like, even though it can be costly to definitely make these modifications, right now, but remaining in your home as you age can be cheaper in the long run than living in a long-term facility. It depends on, a lot of different factors and on like person by person basis, but it's just something to consider there. And I did want to mention, so I'm just going over some general ideas for home modifications, but it's really important if you are thinking about modifying your home to talk to myself or another occupational therapist to really assess how you move in your environment, since I don't really know, specifically how you move in your environment and what your needs are. I can't really make these specific recommendations for you. These are just general ideas, but would love to work with any of you individually to discuss modifications and to see what would be best for you. So if you're interested in that, again, you can email me at intern@gildascasey.org. So we'll start off with the kitchen here. And I'm including pictures of the beginning of each of the kind of segments on the rooms just to get a visual of what some issues be in these rooms. So starting, as you can see, there's really high to a cabinet while standing on a stool, which can definitely be a fall risk there. Also, not having enough counter space could potentially be an issue, and we'll go over kind of ways to help get there to be space in your kitchen. Clutter anywhere on the counters or even around on the ground can be kind of an issue and could put you at more risk of falls if there is more clutter. Rugs as well can be a fall risk. As you can see, this one in this picture is kind of doesn't look like it's very secure to the ground. It's kind of folded over a little bit, so that one definitely seems like it'd be pretty easy for someone to slip and fall accidentally on that. And then also just having a pet around in the kitchen. I know sometimes pets really want to be around in the kitchen, but sometimes people can trip over pets and it can be something kind of in the way. So we'll talk a little bit more about that. But certain problems that could happen in the kitchen, a cabinet that's too high or too low can make it so you're kind of going into some awkward positions that can put some strain on your body if you're doing it a lot. And so ways to kind of not do that as much in your kitchen. If you have the items that you use most often, if you can move those to areas that are closer so that you don't have to bend and reach. So if there's things that you use a lot, like a certain kitchen utensil, if you can kind of organize your kitchen so that the things that you often use are within reach. One way of doing this is instead of like kind of reaching down to get pots and pans in like a low cabinet or something like that, if you were to add hooks to the walls around the kitchen in a way where it wouldn't be kind of reaching too much to get them, but that could be a way to make those more accessible to you. Also, if you need to get something from a higher cabinet, using a long-handled reacher is a good way to do that. And if necessary to get to a high cabinet you can't reach, using a sturdy 3-step stool would be the best choice rather than a chair or a 1-step stool. So if you feel that you don't have enough counter space, some things you can do is if you can move the table that you have closer to where the kitchen is to have more cooking space. If you need to maybe even sit while you're cooking, having that space to use as well, but just trying to keep the counters free of clutter will help with cooking for sure. And then some different items that you can use. If you used a rolling cart, which I'll show in just a minute, you can store items that you use often in that. And then it can roll with you, to the kitchen table if you're kind of doing some things with cooking over there, and then also move it into the kitchen more. So that's one option. And then also utilizing lazy Susans either on the countertop or ones that go inside cabinets. That can be really useful to put a lot of things on and kind of be efficient with the space that you have there. So here are some pictures. As you can see top left, that's kind of what I was talking about with hanging the pots. If you had that either like on the side of the counter, if you had some open space, or just on a wall that isn't too high up for reaching. That can be really helpful. And there's that reacher there that I was mentioning. A reacher can come and helpful with lots of different rooms within the house, but also in the kitchen, if you do have to reach higher, that can be helpful. Those are two options of a Lazy Susan. One at the top is the one that could go into a cabinet. And then one at the bottom is just one that could maybe be on your countertop. So you can fit a lot of different things on there, but have it be kind of organized and efficient. And that rolling storage cart is what I was mentioning as well. And that's another thing that could be used in different rooms, but could be helpful in the kitchen. Here's some more pictures. To make the drawers more efficient in cabinets, you can use pull-out drawers in those cabinets so that you're able to reach them more easily and just kind of be efficient with the space. And there is another picture of that 3-step ladder that I was mentioning. If you do have to get something out of a higher cabinet and you aren't able to ask someone else to help or move it to a lower spot, using a 3-step ladder is definitely safer than trying to do a chair or just a 1-step. So some more issues that might be in your kitchen: rugs. So it's common, for people to have rugs or like mats around in the kitchen. And in a perfect world, removing rugs would be the best choice because rugs can, just be a fall hazard. You can trip over them pretty easily. But I understand that a lot of people do want to have the rugs. So if you need to have rugs in the kitchen or little mat, they do have double-sided rug tape that can be used to secure it to the floor, and it won't, damage your floor at all, but it's just really important to have those rugs secure to the ground so that they don't bunch up and, contribute to tripping or falling. Another issue that could happen in the kitchen is poor lighting. So it's obviously really important to have the lights, to have there be like adequate light in the kitchen so you can see everything you're cooking and everything, but also just to be able to see like where you're going so that you don't fall or anything like that. So with the bulbs that you do have in your kitchen, just checking to see if you can increase the wattage of those bulbs as much as it's allowed to get kind of a brighter light. And you can also add lighting under cabinets, which I'll show some resources for. And then adding more overhead lighting would be beneficial as well. So if you often have a pet around while cooking, one option would be, just so you don't trip on the pet accidentally, would be removing the pet from the kitchen just when you're cooking. There are just like some gates that you can add to the entrance of the kitchen, or if you could put the pet outside for a little bit or in like a little crate that they have, something like that, just so you don't accidentally trip over the pet. Those are just some options there. So some pictures about those that I just mentioned. There's that carpet tape on the left. So it is double-sided and it does work pretty well. You just want to make sure if you do have rugs and you don't feel like you can get rid of them in the area, that you do secure that onto the ground. So for the lighting, there are also some lights at the top here, these puck lights that you can kind of attach underneath cabinets, and they're actually remote controlled. So something like that would be really beneficial if you needed to increase lighting in your kitchen. And then also a light strip, as I have in the middle here, could kind of run along the inside of the cabinets, and that would be beneficial. And then I added just the picture there of the pet gate. So that's another option. Some more issues that might happen in the kitchen: a slippery floor can, happen often in a kitchen when cooking, but it's important to just realize that, if the floor is slippery, that can really contribute to falls as well. So you want to make sure to clean that up immediately. And it's always just a good idea if you can wear shoes or slippers or socks that have a non-slip sole to them, so that it's just, a lot less likelihood of slipping there. If there's not enough room to safely walk around the kitchen, if you're able to remove unnecessary clutter, that would obviously be a good idea. Take a leaf out of a table if you're not needing it, just to make it a little smaller so you have more room, or even moving a table up against a wall if you don't need it to go all the way around with chairs, that would be another idea, just to make some more room and open it up in your kitchen. And if you do use a wheelchair, or if you sit to cook, just thinking about, can you reach and see what you need, or is that, a barrier to you cooking? And if it is, there are some ways that you can change some things in your kitchen to help you cook easier. So you can add a slanted mirror to see what you're cooking, kind of like up by the cabinets, to kind of bend down. So then if you're like over the stove cooking, you can kind of look in that mirror and see what you're cooking. Another idea is a roll under sink. So it can be kind of hard if you are sitting or using a wheelchair to get super close to the cabinets or the sink, if there are cabinets, under the sink. So if you had more of a roll under sink, that could be beneficial, but you do want to make sure that if there are exposed pipes, that those are covered, because you wouldn't want to have any temperature related issues there. So we're done with the kitchen. We're going to move into the bedroom, and kind of the same format I went through before. I have a picture here to look at first, to think about different things in the bedroom that could be an issue. So the height of the bed is something to think about. If your bed's too low, it could be, hard to get up from. And also if your bed's too high, that can also, be an issue for kind of making you at increased risk for kind of falling off when trying to get on and off. Again, there's another rug. So in a lot of these rooms that I'll be talking about, we'll discuss rugs again, but rugs are just a major, fall hazard. So it's something to definitely pay attention to where you have rugs in your home. Any clutter near the bed can be an issue, especially with, getting up during the night. You wouldn't want, to have too much clutter that would impact, your ability to get around, and it could cause you to trip, things like that. Looking at the lighting, seeing if you have adequate lighting and like a night light at night, that's definitely necessary for getting to the restroom. And then also electrical cords that are kind of going across the room, that can be a fall hazard as well. So we'll go into those a little bit more, starting with electrical cords. So one solution to this is rearranging your items so that they're closer to the outlets, so you don't have to have that cord going as far. You can also run cords behind furniture so that they're not kind of within the walkways, which could work well, or use cord concealers or cord covers to hide the cords and kind of have them attached to the wall nearby. So those are just some considerations for cords. And then if your bed is too low or too high, if it's too low, you could add bed risers to be put under each of the legs of the bed, or add a mattress topper to kind of increase the height of the bed there. If it is too high, you might need to think about removing part of the bed frame, or removing like a mattress topper if you have that, or just thinking about using more of a low profile mattress, or box springs, or even getting rid of the box springs if you have it. Just, different things to consider there, but you should be able to touch the ground with your feet when sitting at the edge of the bed, but your knees shouldn't be over the hips. That would be, too low of a bed height. And just another important consideration to keep in mind, the more layers of blankets that you have on a bed, the more fatiguing it can be when trying to make your bed, if you have so many different layers to use. So if you used maybe like a thicker blanket and less of them, or just a duvet or a comforter, instead of having a lot of blankets, that can be good for saving energy there. So here are some pictures. This is a picture of the cord concealer that you can put the cords to go through and then kind of attach to the side of the wall. And then that's a picture of the bed risers that can be put on each of the feet of the bed to just get it higher there. Some more issues that might happen with the bedroom. If you're needing help getting out of bed, there are some pieces of equipment that can help with that. If you used a half bed rail or a bed cane, which I'll show pictures of, that can really help with that. You also want to keep in mind carpet in your bedroom. Is that carpet torn, curled up, or just unsafe in some way? You wouldn't want that to cause a fall. So either like if the carpet just is unsafe, removing the carpet and kind of getting new carpet or just different flooring, eliminating the carpet, the wrinkles in the carpet by just kind of pulling it and getting that attached better. And even if you notice kind of the ends of carpet where it connects with like kind of another flooring, if that's kind of curled up or just not really smooth there, you can install kind of carpet trims at the end of the carpet to help ease that transition between carpet and flooring. So I'll show a picture of that. And if you just feel like there's not enough space to move around, trying to make sure that all the doors can be fully opened and open into the hallway if possible. So you could actually reverse the door hinge to open the door into the hallway if you feel like the door opening into your room is kind of getting in the way of the space that you have. And also moving the bed against the wall if you're sleeping alone. That's just another way to get more space in your room. But also when thinking about removing clutter, it not only helps reduce the risk of falls because you wouldn't be able, you wouldn't be tripping over things if you removed the clutter, but also it can help with improving sleep. So the cleaner your sleep environment and less kind of clutter around, it actually has been shown to improve sleep as well. So just another tidbit there. And here's some pictures. So on the left, there's that carpet trim I was talking about that can be installed and just kind of make the transition between carpet and other flooring to be a little, more smooth there. Here's pictures of a half bed rail and the bed cane. So it's important if you do have a bed rail for it just to be a half bed rail so that it doesn't, become a barrier to you getting out of bed. But just having a half bed rail that's closer to, your top half when laying down, that can really help with, pulling yourself up to get up out of bed if that's an issue for you. A few other problems, if your sleep's disrupted by light coming in through a window, adding blackout curtains to a window could be beneficial. But this, isn't useful for everyone because it could, disrupt your sleep cycle if this isn't really an issue for you. So just kind of taking that by case basis. And getting up in the dark during the night, that, can obviously cause some falls if it is dark and you're trying to navigate to the bathroom. So it's really important to add night lights in your room and especially going from your bed to your bathroom, making sure that pathway is lit up. So you can do this in a variety of ways, but adding motion sensor lighting or rope lighting, those are a few ways to increase the light there. And also just making sure to organize your bedside with items that you usually need or might need in the middle of the night so you can minimize the amount of times you have to get up and walk around your room when it's late at night. So just keeping that TV remote or phone and charger, water, anything like that that you think you might need during the night, just trying to keep it at your bedside. And here's some more pictures, blackout curtains on the left, and a few different options for lighting. So at the top here in the middle, those are night lights that plug into the outlets directly and they're motion censored. So those can be useful if you kind of have a path going to the bathroom and to also, utilize in the bathroom as well. And then this rope lighting can be used in a lot of different areas of the home, as you can tell. But could be another useful tool for, making it be lighter between your bed and your bathroom. It's important though with this rope lighting to try to keep it, on a wall or like on a surface, not like on the floor, because you wouldn't want that to cause you to trip even more there. And then specifically with your closet, adding a motion sensor lighting or like a lighting that you can kind of touch to turn on inside the closet, that can be beneficial so that you make sure you can see everything. And like I mentioned with the kitchen, having a long handled reacher can be really helpful to reach items that are higher up in your closet, but also trying to bring clothing and the things that you use often to a height that you can reach. So moving your clothing rod down if that's something that you need, or if you use a wheelchair or if you're sitting in a chair, if you have a chair by your closet, the rod should be about 42 inches And another thing is typically closets, having items like kind of hung up can be easier than getting in and out of drawers. But if you do use kind of shelves, having them open without kind of a door to open or something to pull out can be really helpful there as well, kind of minimize a step and things like that. And also, but if you do have shelves that have kind of like a drawer or something, making sure that they're light. Okay, so now we're going to move into the bathroom. This is probably the area of the house, well, most definitely that I have the most kind of content to talk about because the bathroom can be the most dangerous room in the home, and 80% of bathroom accidents result in falls. So it is just something to really keep in mind to see if there are any changes that you can make in your bathroom just to make sure that you are as safe as you can be, because falling in the bathroom could make someone have a fear of falling again in the bathroom, and that can then contribute to them maybe, not wanting to bathe as frequently or clean themselves as well as they can, just having that fear of falling again in the bathroom. So it's just really important to do what you can to make sure that your bathroom is as safe as it can be, and so that you and everyone that uses that bathroom has the most control that they can have in there. So here's another picture of just some areas of a bathroom that might be problematic. Not having any grab bars or any assistance near the toilet to help you get on and off, and just for stability there. If the toilet were to be too high or too low, that can also cause some issues there with getting up and down from that. A rug, again, this one especially looks like it's not very securely attached to the ground, and it's kind of wrinkled and folded on top of itself. So that can be really unsafe in the bathroom and in all rooms of the home. And then there are also not really grab bars around the shower here in the tub area. So that is another area that can be really useful to have some sort of support to hold on, like a grab bar. If the tub floor is slippery or slippery anywhere in the bathroom, because that's easy to happen when you're bathing, that can definitely be a risk for falls there. And this tub in this picture looks to be pretty high, so it could be difficult to get in and out of that tub there. So I'll show one piece of equipment. It's called a tub transfer bench that could be useful for a bathroom like this one. So we'll get into this now, starting with the first kind of issue, an unsafe bath rug. The best kind of bath rug, bath mat to use outside of the bathroom or outside of the tub, to be like directly outside in the bathroom there, would be something that's very thin. You wouldn't want something thick that you could easily kind of trip over. And you want it to also be like non-skid backing, kind of using that tape there as well to make sure it can be secure to the ground, or some sort of non-skid backing there. Another thing to remember, which I'll talk about more throughout the rest of the presentation, but a color contrasting rug can be really helpful. Just the more color contrast you can have within your environment can really help individuals with low vision, as well as just everyone, be able to kind of differentiate where things are in their environment and just, minimize the risk of falls. So like if your whole bathroom was white, let's say, it'd be really hard to tell, where is the floor versus where is the tub, things like that. So if you had a color contrasting rug, that can really help show like where it is that you can step and just things like that. Another helpful tidbit, if you're able to remove the bath mat rug situation when you're not bathing, that can be really helpful to minimize the risk of falls when you're just using your bathroom at other times throughout the day. So obviously, like, I know bath mats are used a lot when showering, to have, when you're getting out of the shower, to stand there when you're drying off and things like that. But when you're not using it, it would be good to kind of put it over the tub or something like that, just so you're minimizing the risk of tripping at all. If a toilet is too low, you can add a raised toilet seat to that. And it just depends on what height is right for the person. But for some, if it's too low, it could be hard to stand. Not enough lighting in the bathroom, that can be a real issue. So again, you can increase bulb wattage if that's possible, or install motion sensor night lights to the bathroom, kind of like I mentioned. But that can be really helpful so that you don't have to try to find the switch if it's dark, so that you're just kind of walking in and the lights will turn on. Also adding more overhead lighting if that's needed, if there's just not enough lighting. That can be either motion sensor or clap lights. But yeah, you just want to make sure within all rooms of the home, but in the bathroom too, especially, you want to make sure there's enough lighting just so you can see everything and minimize the risk of falls. So here are some of the pictures of things I've talked about. So a raised toilet seat on the left there, that can be used to make the toilet seat higher. There's some overhead lighting options that are motion sensor that can just be easily added to a bathroom. And here are a few bath mats that are pretty good. They're thin, which is good, and having that non-slip bottom is really important as well. And having a darker color. So see how they're kind of a darker gray color compared to the white flooring. That's really important for that color contrasting piece. So we'll talk grab bars here for a second. In the toilet area, it'd be beneficial to have grab bars there in the walls that are close to the toilet. So you can have grab bars that are horizontal or vertical. They're typically 33 to 36 inches high. But it's best to just see if you're wanting to use grab bars, have an occupational therapist kind of look at you, move through that area so that you are able to install them in the correct position that will work best for you. And if there's no wall close to the toilet, that doesn't mean you can't use grab bars. There are options for that. You can actually add a grab bar that folds down from the wall, or you can use a toilet frame and rail, or even have a bedside commode kind of put over the toilet so that you have railings there. So I have pictures of all that we'll go through. And then also in the shower and bath area, it's important to have grab bars as well. So you'll want one kind of at the entrance of the shower, one that's maybe more vertical can be helpful there. And then on the side of the shower bath wall, one that's maybe horizontal there, and then near the faucet handles as well can be helpful. And if you have a tub and you're not maybe wanting to install grab bars, they do have a grab bar safety rail that I'll show a picture of. That can be an option. It just attaches to the side of a tub. But it's important that it's rubber padding on this attachment clamp that I'll show and has a non-slip handle grip. Those are just really important pieces there. And it is portable, which can be good if you're, using different bath areas or going on a trip or something. But installing grab bars to the wall is the safest option since that's like a permanent option there. And you just want to make sure to stay away from suction cup grab bars because those with body weight can come detached from the walls, and that's, really not a safe option there. More on grab bars. Again, don't use those suction cup grab bars because they can't support the body weight. And grab bar mounting brackets must be attached to studs in the wall with bolts so that they're really secure there. If your shower's fiberglass, you have to use specific fiberglass mounting brackets. But again, have an occupational therapist watch you navigate your bathroom to see where would be best to put those grab bars. And later in this presentation, I'll give some resources for how you can install grab bars and have someone help you with that, since it is kind of a big project there. And the brand Moen is an ADA approved grab bar, so that would be a good recommended brand to go with. Here's some pictures. So yeah, there's that bathtub safety rail on the side, on the left side there, that attaches to the bathtub. And there are just some pictures of different positions that grab bars can be in that can be helpful. So next to the toilet, a horizontal and a vertical one can be beneficial. And then you can see in the picture there, kind of the different locations that I mentioned that can be beneficial for a shower or tub area. And here on the left, there's the toilet safety frame and rail, and then a bedside commode there. And then one thing that is kind of beneficial with those toilet safety rails in the bottom middle there, those actually can attach to the toilet seat. So those can be safer to use than like a toilet safety frame that's not directly securely attached to the toilet. Because with a toilet safety frame, there is a chance that it could tip over and just not be as sturdy as those toilet safety rails. So just something to keep in mind when comparing different pieces of equipment. And then top right, that's the flip up grab bar that I mentioned. So some more problems here. If you have a slippery tub, obviously that can cause falls. So within the tub and shower, you want to make sure you have a non-slip bath mat and some if you don't go with that option, you can also do adhesive non-skid decals that can be kind of put onto the bottom of a tub, and non-slip coating that I'll show you that can also be applied to that area in the bathroom floor just to make it not as slick. If you do experience some impaired temperature sensation, it can happen with neuropathy often. Installing a water thermometer to the shower or bathtub can be beneficial just so you make sure that you know what temperature is good for and safest for bathing. And then clutter, like in all areas of the home, if there's too much clutter, that can contribute to a fall. So thinking about ways to store clutter in your bathroom, that can be like floating shelves by the sink or any shelves like over the toilet. Again, without cabinet doors can be more easily accessible. And then in the shower, if you were to have a shower caddy that's attached in the shower, easy to reach is an important thing to remember. You don't want to have to, like if you're sitting in a shower chair, you don't want to have to reach super far or get up to grab something. So if you do have a shower caddy that's attached closest to where you can reach, that's beneficial. So here are some pictures there. And I'm kind of noticing the time here, so I'm going to kind of run through some of these a little bit faster here. I will, with the follow-up email, send out kind of the resources of all these pictures that I'm including in the presentation. So if there's something that you're interested in, you'll be able to see where I found that. So other issues could be if you don't have a shower chair, it might be beneficial to have one. So adding a shower chair in your shower could be beneficial just for decreasing the risk of falls. And if you do get fatigued, being able to just sit down in the shower can be helpful. Difficulty stepping over the tub. If it's a really high edge, a tub transfer bench can be used, which I'll show. Difficulty reaching water, especially if you're using a chair or a bench in the shower. Having a handheld shower head can be really helpful so that you can aim the water where you're wanting it to go and just be able to bathe easier. And if you have difficulty reaching a sink, such as like if you're using a wheelchair or sitting at the sink, the cabinets below can be kind of a barrier, like I mentioned in the kitchen, to being able to really reach everything that you need. So if you had a roll under sink with the cabinets kind of taken out underneath so that you can get closer, that can be beneficial. But again, you want to make sure the pipes underneath are insulated. But the best shower, most accessible bathing design would be a barrier-free shower that doesn't really have any kind of barrier to get into the shower. It's just kind of like a flat surface there. That's obviously the safest. But here are some options that I just mentioned for bathing and sitting in the shower. And with tub transfer benches, the one I included here, it has a little slit there that the shower curtain can go into. But if you don't have one like that, a lot of tub transfer benches don't. You can use a shower curtain like I have listed here that kind of has a way for the shower curtain to kind of go through the bench so that it keeps the water in. Other helpful tips that you might want to think about, a long-handled brush or like loofah can really help, as well as a long-handled razor, just so you don't have to bend and reach as much. And then any kind of push button or automatic soap dispensers that can be mounted to the wall in the shower could be really helpful, as well as just pump shampoo bottles can all be, just easier to use. So bathroom don'ts, don't use towel racks or sinks as a grab bar. If you feel that you are holding on to them for a lot of stability, it's probably best that you do just install a grab bar so that they don't get pulled out of the wall and then you wouldn't fall. That could be, really bad. So something to avoid there. Don't have unnecessary rugs. Again, that's a big fall risk. And never step on a loose towel because that can, make you slip. Minimize all slippery areas, obviously in the bathroom. It can, water can get in a lot of different places to make things slippery, but that can really contribute to falls. So drying yourself off as much as you can first, and make sure your shower curtain or door is able to keep water off the floor as much as possible. And again, with the pipes, you want to make sure those are insulated. So now we'll move into the living room, and here's a picture here. We always want to think about lighting. Is your furniture too low? Do you have enough space to walk around? Again, rugs, cords running across the floor. Is the furniture safe and sturdy? And how are you able to access those light switches? So if you have difficulty standing up from a couch or a chair, you can add furniture risers like we mentioned in the bedroom, but you can add them to the bottom of couches or chairs. And there are actually some couch standing aids that you can kind of push up with or pull up that I'll show a picture of. And there are lift recliners that have a remote control that can help slowly lift you up and just make it easier for standing up. But it's important to remember to think about these options, but try to not sit on pillows because they can cause you to kind of slip off and fall off of the couch or chair. So they're not the best option. And if there's clutter and you're not able to move around as well in your area, you definitely want to think about minimizing that clutter as much as you can so that you don't fall. So utilizing shelves and storage areas to get things off the floor and tabletops, and only have items that you commonly use kind of on side tables and things like that. Avoid carpet with a lot of pattern, just if there's too much kind of going on in an area. That can be kind of a lot for your eye. It kind of goes with that color contrasting piece that I mentioned earlier. Just so there is, contrasting colors there and not like too much going on so that you don't, it doesn't contribute to falls and things like that. Removing furniture that you don't use often. I feel like sometimes there are those places in the living room that, no one usually sits in, but if it's just in the way, thinking about maybe moving it or just rearranging the furniture so that you have enough room to move. So here's some pictures of the furniture risers, and these are some ways to help with standing up from a chair or couch. So these are just different stand assistants and aids there that are again included in the resources that will be sent out if you're interested in looking into that more. Here are pictures of the lift recliners and the CarX Up Easy, which can help with standing up as well. So poor lighting, or if you have a hard time accessing light switch and lamps, one option is adding a clapper light switch or a remote light switch to turn it on. Adding motion sensor lighting overhead, or just rearranging the furniture so that you can more easily get to that light switch. It's just important when thinking about when going into rooms in your home, how easy is it to get to that light switch? So if it is difficult, thinking about changes that you can make there, because you wouldn't want to start walking through a room with not being able to see very well. Again, with color contrasting, thinking about, is the flooring, furniture, table, is it all the same color? Because that can make it difficult to see and difficult to just navigate. So thinking about that. Rugs, we've already kind of covered, but something to think about in the living room. And again, if you have cords going through areas that you walk, thinking about the cord concealers or running them behind furniture or rearranging items. So these are some of the lighting options: the clapper switch, remote, wireless outlets, or there's something called a Hive Active Smart Plug that kind of connects with your phone. So if you have like a lamp plugged into this, then with your phone, you can turn it on. Hallway. I see we're running out of time, so I'll try to go through this kind of fast, but again, you want to think about lighting, clutter, how easy can you reach the light switch, and the flooring, if it's uneven or could cause you to trip. Another thing to think about, if doors are too heavy or if they swing shut too fast, that can potentially throw off balance when trying to walk through. So there's some resources that I'll show you, like a magnetic door stop to doors, to kind of keep it easily open when passing through. And if doorways are too narrow to fit a walker or wheelchair through, one option is widening the doors, but even easier options is adding offset hinges to the door. Can give you just a few more inches there to open the doorway there, and making the door swing out of the room so that there's more space, again, is beneficial. And taking the door off obviously could be an option if privacy is not needed for that certain room. So here's some pictures of the magnetic door stop that could be beneficial, and also the swing clear hinge. As you can see, it just kind of gives the door more room to move out and can add a few inches in that doorway. If there's uneven flooring, removing rugs, adding that carpet trim, clutter, trying to organize and just remove clutter throughout the walkways. And then if you notice that it's pretty dark and not enough color contrast, adding lighting. It can be important with hallways to add a light switch at both ends if you don't have that. And if that's not really an option, even motion sensor lighting can be important there. Staircases, again, thinking about lighting, railing, and the steps. Are they kind of slick, or do you have any tread or carpet there to make them less slick? So lighting, I've kind of talked through lighting, so I'll move past that. But railing, add railings, and think about ones that have a good grip, which I'll show a picture of just to ease, going up and down the stairs. And if there's slippery step or there's kind of slick steps there, thinking about adding adhesive stair treads onto there, or a carpet runner, just so that it's not as slick. And if your steps are the same color, and if the flooring at the bottom is the same color, it can be really hard just with that color contrast element to differentiate the steps and see where the steps stop. So one option is adding a different color stair tread to each of the steps, or tape, and even at maybe just the bottom of the step or things like that, just so you know when the last step is. So here are pictures of the lights, a railing with good grip, and the stair treads and the grip tape there. Outdoor entrances, some things to think of is the concrete uneven or cracked? Do you have lighting at night? Do you have stable railings? Are the steps safe to go up and down? I'm thinking about the threshold of like the door frame where you kind of have to get into the door there. Is it hard to see, or is it raised pretty high? One good thing to think about is putting a chair or a bench near the front door. Just if you do get fatigued when entering the house, you can put things down and sit down yourself. If you don't have handrails, obviously installing handrails, at least on one side, but both sides would be best, and stabilizing those if they are unsteady. If there's issues with the steps, if there's too many steps or too high, you can always install a ramp or a lift. And adding a threshold lamp in a contrasting color to the doorway there can prevent tripping and also help with ease getting in there. And if there's uncracked or uneven pavement, you want to make sure to repair that and avoid those areas when walking as possible. Lighting, motion sensor lighting at night would be beneficial. If it's hard to open the door, you can add a door handle extension, which I'll show. A vertical grab bar near the door to give that support while opening the door, and installing a smart lock system with kind of your phone so that you don't have to deal with locking the doors, or using adapted key turners. More with color contrast there between the steps and the door frame. That just helps with the ease and seeing where you're going, and knowing exactly where the threshold starts or step stop, thing like that. If the doorbell is not accessible or not easily heard, you can install a video doorbell to sync to your smartphone. or a doorbell that flashes an LED light throughout your home to notify you. So here are some pictures here of the things that I just mentioned. And again, this will be sent out as well in some more pictures here. I know we're really running out of time, but my last part was a laundry room in the basement. And I think many of these issues we discussed that can be kind of in other areas of home as well. But definitely with going into the basement, you want to think about the steps there. And if there's railings, things like that. And yeah, you always want to think about lighting, clutter. Do you have clutter where you're walking? Do you need to add storage organization for things to be easily reached? Adding that stair tread, adding the lighting to the stairs, adding color contrasting elements would all be beneficial. So that was the end of the different rooms. I do have some important fall prevention strategies to remember that I'll just go over in the last few minutes here. So lighting, always turn on lights before entering a room or going upstairs. Make sure the switches are easily accessible. And like I mentioned, greater contrast in the environment, the safer it is to navigate. Remove clutter, cords from walkways, areas you commonly use. Utilize mobility equipment if you need it to safely navigate your home, like a walker, a cane, or a wheelchair. If you feel like you're grabbing onto walls or furniture when walking, it might mean that you would just benefit from a device to help you support you as you walk. Minimize any slippery surfaces. Utilize grab bars. Avoid any awkward positions, bending down or reaching high. So move items close to you. Organize things differently. Have a plan for taking care of ice and snow. That's important in the winter months so you don't fall. And don't rush around when trying to get to the phone or the door. Kind of let it wait because you wouldn't want to fall on your way there. Fix any uneven flooring. If it's carpet, cracked pavement, some of the things we mentioned there, just try to fix any uneven flooring and have a chair to rest in all areas of the home so that there's always just a place where you can sit down if you're feeling fatigued. So I don't have time to go through these resources, but they will be sent out in the follow-up email. These are just resources if you're wanting to make changes to your home, where you can do so and get help for doing so. It has the links to all of these and then low cost resources for doing so. And these are all like Kansas City specific and different companies. So there's actually a lot of resources out there in the area. So you can look through that when it's sent as well. And I'm always available to help you as well to go through these resources and just find what might be best for you when modifying the home. This will also be sent out to you just to kind of get started and think about your home. Along with this will be kind of a checklist to go over the different kind of issues that I mentioned in each part of the house to see if this might be something that you have in your home, and then you can kind of determine where you want to go from there. So yeah, there will be a follow-up email with all of this information included. I did want to mention that these modifications would not only help someone who is at a higher risk for falls or other safety hazards, but it's beneficial for everyone. Everyone could utilize a grab bar in the shower. Everyone slips in the shower. So having things like this throughout the home would just be beneficial for everyone. Here are my references. Sorry, we're going a little over. I did want to mention, since I am a student, I would really appreciate any and all feedback that you might have on this program about things that you found helpful, what you would like to have heard more of, or just anything like that. So this link will be sent out in the follow-up email, and I'll also in a minute try to send it in the chat if you would like to just do it kind of right now. But I would really appreciate any feedback, and it's all anonymous. And again, if you want any support in making these changes, please contact me at intern@gildasclubkc.org. I'd be more than willing to meet with you, discuss some of these things, and figure out what might be best for you. So that is